Pediatricians have welcomed the approval of the Pfizer COVID-19 vaccine for children. They say the third wave has seen more children being infected by the virus. They stress that COVID-19 vaccines are safe for children. Let's get more on this. I'm joined by Professor Mignon McCulloch, who is an executive member of the South African Paediatric Association. Thanks so much for your time on The Full View this evening. Talk to us about how the third wave has affected children in particular.
Thank you very much for having me on your show. And we are, as you said, relieved to hear that the vaccine will be has been agreed to be safe for children and will be rolled out. The new variant, the Delta variant, has been different to the previous variants, and we've definitely seen children become much more infected with this. Still not as sick as the older population, so we know that older people get really ill with COVID, but we're seeing more and more children now becoming infected. We are seeing an increase in hospital, but not children with severe illnesses, but we know that this Delta variant is much more contagious. And so we are delighted that vaccines are going to be made available for children between 12 and 18. This is in keeping with what's happening in the rest of the world. So we're not the guinea pigs in South Africa. In fact, if anybody was the guinea pigs, it's the healthcare workers. We stuck our arms out at the beginning of the year. And as you heard from the previous interview, the lady was saying so many healthcare workers are now surviving and not becoming really ill and dying because of this COVID infection. So we are pleased. It's going to be rolled out between the 12 and the 18-year-olds first. Obviously, the priority is still our older adults, but we know that vaccines in children really work. We've seen that with all the childhood vaccines. We've got rid of conditions like smallpox. We just don't see it anymore because we vaccinated children against that. Infections like TB, like measles, those have been real killers, and when children are vaccinated at a young age against that, they carry immunity with them. So we are pleased. Obviously, this will need to be done in a controlled fashion, and my heart sinks when you hear those numbers, 85,000 people who've died, and we definitely can prevent this by having a safe vaccination program. And so we really need to spread the word that this is good news. Vaccines is the only way in which we are actually going to get back to some kind of normal life, where we can actually meet with our friends, meet with our families, and actually not have the vulnerable in our families become ill and potentially die from this infection.
Right.
So good news for everybody.
Talk to us about what needs to happen in order for a vaccine to be approved for safe use. What are the processes?
Yeah, so that's a good question. We know that 5 billion people worldwide have now been vaccinated. These vaccines are produced in laboratories where they are extensively tested, usually for about a year. Then we start off with adult trials, so we see that it's safe in adults before we consider it in children. And we know that the Pfizer vaccine has already been tested in 2,000 children in North America. So in many ways, South Africa has been a little bit fortunate in that we can actually look at the other countries across the world and see what's been happening there. In America, they are now rolling it out into younger children as well. Europe is definitely giving it to their teenagers. And for us, the big deal is getting our kids back to school, because a lot of them have missed out on almost 2 years of learning. A lot of them get food and nutrition at school, so they've been going hungry. They've become physically and sexually abused, and mentally they've suffered. So a vaccine can really change their lives.
All right, you've spoken about this earlier on, but I want to go back to it because whenever this issue of vaccines comes up, this is a concern. Parents saying they're not sure if it's safe. I know you said we're not guinea pigs, but talk about why children should get vaccinated with a relatively new vaccine that we haven't heard of before. And as a parent watching, why should my child go and get vaccinated?
It's a very good question, and we understand parents' anxieties. So the vaccine should actually be rolled out to everybody. At the end of the day, realistically, we'll probably be getting a booster shot like a flu vaccine every year, because COVID's not going to go away. I think in the beginning we hoped it would. But these vaccines have been tested. As I said, 5 billion people across the world have now had it. We've done very careful observations in the older population, the over 60s, over 40s. We're now down to the 18s and above, and we've seen that worldwide they're now introducing 12 to 18 and even younger. So if a vaccine is safe, it's been proven to be safe in adults, and we're going to be looking very carefully at the children as well. This is not experimental stuff. These are vaccines that are proven to be safe, and they've definitely saved lives. If you look at the people in hospital at the moment who are really sick, almost none of them have had the vaccine. So that's really turned around what happened last Christmas. Last Christmas, people were in hospital. The vaccine wasn't easily available. This Christmas, those who have been vaccinated have a good chance of not becoming significantly ill, and the same will hold for children. So we need to save our country, and we all need to work together. Like we wear masks, I wear a mask to protect you, you wear your mask to protect me. In many ways, this is what's going to happen with the vaccines, and we feel pretty confident that it is safe for children as well.
Professor Mignon McCulloch, who's the executive member of the South African Paediatric Association, thanks so much for your time on the Full View and SABC
Thank you very
News
much
this afternoon.